Excuse me, cough. You have overstayed your welcome. The cough no key you. Check out. Aha! Large man. You get cough. You sabi person where they cough. You reach 2 weeks or more. Make you check that cough.
Our people they talk say everybody work na nobody work. But it gets some work where everybody supposed put hand, where some people don't start and everybody they enjoy the benefit. My people, una welcome to another correct TB Tori, for where we dey shine big torchlight put for the waka to end tuberculosis for this country complete. This program they reach una from KNCV Tuberculosis Foundation, Nigeria. People wey don dey nearly enter year 5 for this fight against this wicked disease where they thief joy before it thief life. Tori for TB Tori no go day today, but na me, una personal person Ufoma Iguri as a tanda here with una for this special package. You fit to follow us for social media to learn many things, hear different opportunities wey go benefit you and me, and even win our Woof recharge card. Just go Facebook for KNCV Tuberculosis Foundation Nigeria. Like us and follow us because you self know say we dey try. For Instagram and Twitter na KNCV Nigeria, but for Facebook na KNCV Tuberculosis Foundation Nigeria.
Make you check that cough.
Now for the TB fighting community and the general public wey sabi better thing o, correct program dey come for where more ways to finish off this sickness go still comot. This program na the annual National TB Conference for 2021. Annual means say it dey happen every year, but this year own go sweet pass all the ones wey don dey happen before. Yes. The different partners and stakeholders for the Stop TB Partnership Nigeria, they gather body they do this conference. But the team for this year own, they look how to maintain very strong response to TB for we country with special checking on how COVID-19 and other diseases take affect them. For English, this team sweet oh. They say, now sustaining a resilient TB response in Nigeria, addressing the impact of COVID-19 and other diseases. The National TB Conference 2021 they hold from the 9th till reach the 11th of November 2021. And today we go do radio pre-conference. It get many parts of this TB fight where they join hand, they join body, we come they comot the correct result as a whole. We will they jolly today so all this free treatment, free testing, free this one. Now the work of different arms where join body do like Voltron to fight them. Now make we think am. Wetin bring this subject, this team where they choose for this year National TB Conference. Now we own Dr. Bertrand Odume, will be Executive Director for KNCV Tuberculosis Foundation Nigeria and Chairman of the Central Planning Committee of this conference. Now he go give us that yarnings.
The proposed theme for the conference is Sustaining Resilient TB Response in Nigeria, addressing the impact of COVID and other diseases. The theme captures the present-day reality with COVID pandemic, which has impacted negatively on TB program response in Nigeria and other countries. Provisional data compiled by WHO across 84 countries had shown a 21% reduction in TB case notification in 2020 compared to the figure for 2019. And in the 3 of the highest TB burden countries, India, Indonesia, and Philippines, TB program data fell by about 25 to 30% at the peak of the pandemic. But it may interest you to know that in Nigeria, response to the coronavirus pandemic notwithstanding, data indicates that there has been a 15% increase in annual TB case notification in 2020 compared to 2019 figure due to strategic interventions by the National TB and Leprosy Control Program in collaboration with other TB partners working in the country. This shows a very resilient TB program, and the theme highlights the need to sustain this effort despite these challenges.
Una hear am, this TB fighting really dey strong o, and na how to keep am strong till TB disappear finish na im be the koko. How will Nigerian government and the partners on top this TB matter they stand gidigba to maintain this response to TB for Nigeria where you know they fail? To answer this other question, we get Dr. Ayodele Awe, wey be the National Professional Officer TB WHO Country Office for Abuja and the acting chairman for the Stop TB Partnership for Nigeria.
TB is still a major problem in Nigeria. Nigeria has the highest TB burden in Africa, and is rated among the first 6 highest TB burden in the whole world, after countries like India, Pakistan, Indonesia. The common thing about us and this country is the population. Since Nigeria is still the most populous country in Africa and is about 200 million, so the magnitude of TB in Nigeria is very, very high. We expect about 420,000 new cases of TB every year in this country because of our incident rate. However, in spite of this big number and the effort of government in the past 20 years since the TB program was created, we have made some tremendous progress towards reducing and controlling the disease. We still continue to have increase in number of TB cases, and it is becoming worrisome now because we started to see in few years ago increase in the number of drug-resistant TB cases from new cases. Out of these 429,000 TB cases, we have seen that in the past 15 years, we are always detecting about a quarter of them. It was only even last year during the COVID that we had the largest number that we have ever detected. So what will the government and partners do? As at now, our efforts since 2014, we have only been able to have about 220 gene expert machine in Nigeria. The gene expert machine is able to detect tuberculosis in the sputum that is produced by a TB suspect within 2 hours. And this is different from the 48 hours that is given for sputum microscopy. So if we have this machine that's able to do rapid detection of the mycobacterium, the germ that causes TB, in almost every health facility, or at least one in the LGA in Nigeria, then we will have increased the access and accessibility of the community of the TB suspect to diagnosis. Major things that we need to do if we want to continue to ensure that we make rapid progress to TB control in Nigeria and increase our case detection, we, the partners, as well as government, should increase access to diagnosis. Let us buy more gene expert. With this, we'll be able to increase the number of cases detected, and we'll make rapid progress towards eliminating TB and meeting the TB target of 2030. Thank you.
Correct. The public-private partnership really dey help for this matter. Na part of wetin we go still talk well for the conference. Another issue na the matter of all those science discussion and yarnings wey we suppose dey expect for the conference, the ones for the real book people. Professor Lawal Umar of the pediatric, that one na children, infectious diseases for Ahmadu Bello University Zaria, and the chair of the scientific committee, na go give us that one.
So the kind of scientific discussions that will take place during the 2021 National TB Conference will rally around the major theme of the conference, which is sustaining a resilient TB response in Nigeria through addressing the impact of COVID-19 and other diseases. The national conference will provide a platform for all stakeholders to deliberate on the magnitude and dimensions of the effects of the pandemic. It will also create an opportunity to learn lessons from the experiences within Nigeria and from other countries, and to come up with strategies to address the TB control during the current epidemic and future epidemics to come. So the objectives of the conference were therefore crafted to address scientific issues around the thematic areas of the conference, which will include scientific discussions about patient advocacy and community engagement in TB control, the clinical science and research aspects of drug-resistant tuberculosis, TB HIV co-infection, as well as TB COVID-19 co-infection, both among children and adults. It will also have a lot of scientific discussions on TB in correctional facilities, as well as IDP camps and other vulnerable settings. So it promises to bring together stakeholders from all over the country, as well as around the world, involved in the control effort to end TB. Thank you.
Serious matter, make you take no say no be joke. We been yarn with Dr. Chukwuma Anyike, wey be the National Coordinator and Director of NTB-LCP for the Federal Ministry of Health and board member for NSTBP, on top how government dey take put hand for this TB response matter.
The government of Nigeria supports this partnership towards kicking out tuberculosis in Nigeria in majorly 3 ways. Number 1 is the creation of enabling environment
for the implementing partners. And this is done through the formulation of effective and efficient policies. The second one is the provision of adequate manpower. This is done through the federal, the state, and local governments. These drive the interventions at these three levels. The third one is the provision of funds. So we know that provision of funds may be suboptimal, but strategies are being put in place to ensure an increment in budgetary allocation towards tuberculosis intervention in Nigeria.
No be say government no dey work o. As una don hear, all join for this working. But wetin the Nigerian government and we as country people fit to do to still make sure say our environment dey ready for the better things wey dem go agree for this conference come wan do for us. Now we correct Dr. Temitayo Ojusote wey be the TB team oga for the Office of HIV AIDS and Tuberculosis for USAID for Abuja. Na im go tackle this one for us.
I must first say that it's commendable that in recent years there's been increases in the numbers of tuberculosis patients that have been reported, detected, diagnosed, accessed treatments from Nigeria following the decade of stagnation. The conference once again comes and it's very welcome, and it's really most important that the government and the people of Nigeria follow up on the recommendations from the conference. I would say the first thing is government ownership to address this epidemic of TB in Nigeria. And one of the paramount issues is budgetary allocations, budgetary releases. In addition, the technical assistance and the donor support should be taken advantage of. The government, the relevant ministries should use this to build local capacity to ensure sustainability of the efforts and interventions that are ongoing. It's important that interventions to address the TB epidemic be driven by data and be evidence-based. The people of Nigeria need to take ownership. We have local unions, we have grassroots organizations, we have different types of committees and gatherings, professional associations. Awareness creation is critical. Just being our brother's keeper. It's a collective responsibility to address the TB epidemic in Nigeria.
My people, shebi you see say you gats to follow this national TB conference wey dey come so. Make yourself sabi the good things wey dey happen for this TB matter for we country for all sides. The executive secretary for NSTBP and the National TB Conference Central Planning Committee, Mr. Mayowa Joel, go give us how you go fit to register for the event and more to expect.
The registration process for this year's National TB Conference is very simple. Just go to the website, the conference website, www.nationaltbconference.org. Once you get to the website, you will see the link, register now. You can register through that link. The registration process starts with the payment, and after the successful payment, you will be directed to the actual registration page. So the process is very simple and straightforward. This year's National TB Conference promises to be more exciting, more educative, and more entertaining. We are expecting dignitaries from all over the world. We're also expecting robust abstracts. We're also going to be having a community village, which we didn't have the last time. And of course, we're going to have partners from all over the states to showcase the best practices and the work they have been doing to end TB in Nigeria. Thank you.
After all this one, not too much talk. Just follow these yarnings for we Facebook page for KNCV Tuberculosis Foundation Nigeria. KNCV Tuberculosis Foundation Nigeria for Facebook. For there you go fit ask all the question where you want and still fit to chop a wolf recharge card and different things. Our question for today, they very simple. Where you go fit to win a wolf recharge card for we Facebook page now. Wetin be the date of the National TB Conference 2021? Wetin be the date of the National TB Conference for 2021? Follow us for KNCV Tuberculosis Foundation Nigeria. Go answer the question for there. Gather your people, make the like am. I will recharge card to follow some people. My name na Ufoma Eguria say. Till we carry come again, abeg remember to check that cough. Make you dey sure. Na bye yo.
Make you check that cough, check that cough.